We are here with one of our favorite people, David Weingart, founder of Fit4D. How are you, sir?
I'm great. Pleasure to be here, Unity.
Tell us about Fit4D.
So the day Fit4D began was the day that I walked into a doctor's office, no energy, stepped on a scale. It's 158 on a normal day, and I was down to 128. I'd lost 30 pounds and didn't even know it. And the doctor told me I had type 1 diabetes. I was overwhelmed. I was in shock. I have no diabetes in my family. I've been an athlete my whole life. And I was really fortunate to get great guidance from a certified diabetes educator clinician who helped me take all that information on the internet and personalize it to me and make it meaningful, and gave me the support, the compassion, and most importantly, the hope that I could live an empowered life with diabetes, which I have. So I left Microsoft to found Fit4D to bring that same experience of the human touch, scaled through the use of technology, to the 30 million Americans in the US that have diabetes and the 500 million people in the world with diabetes.
I've seen you talk about this concept of the power of the human touch before, and you just mentioned it. What does that mean? Tell us more about it.
So most patients who leave the doctor's office, whether they're newly diagnosed with diabetes or they were asked to change their medication from an oral to an injectable or whatever, they are completely overwhelmed. They don't know what to do. They're fearful. They have maybe a family member that passed away from diabetes. 50% of them don't even initiate and stay on their medications. And these are people who are not going to download an app to learn to kind of self-manage their diabetes. They need someone that builds trust with them, that gets inside their world and understands their day-to-day life and helps them solve for these challenges every single day. And what we found is, unlike a call center, using diabetes expert clinicians who are really knowledgeable in the disease and understand the medications and all the side effects and how hard it is to get it on an injectable, and low blood sugars and high blood sugars, makes all the difference in the conversation, because it elevates the value of the conversation from an emotional and clinical perspective.
Talk a little bit about how Fit4D's maybe different and how your approach is different from how others are trying to solve this big challenge.
Yeah, a great example is when I speak to the chief medical officers of health plans. They all have care management programs, they have disease management programs, they have call centers, and they're trying to solve for the people who are costing them the most money and trying to improve the health of members. And they're doing a great job, but what seems elusive for all of them is the 18% of the members who account for 40% of the costs. The ones that are really hard to engage, trying to get their behavior changed, help them get on the medications. And so they're usually engaging in the single digits. We've engaged upwards of 30% of that population. When we talk to these CMOs of the health plans, they realize that this is a value add. This is about going deep with their patients and complementing their existing care so that we could bring the patient back into their existing ecosystem much healthier.
So you really are seeing so much traction with health plans, but you're also seeing traction with pharma and med device. What are you hearing from the CMOs of those types of organizations?
Yeah, so for pharma, they're dealing with the front end of the problem. They're dealing with that the patient is initiated, prescribed the medication, and 50% of them don't start it or drop off in the first 6 months. So they're losing billions of dollars of revenue right from a financial perspective, and of course they want from a social mission to improve outcomes. And if people don't take their medications, they're not going to be healthier. So what they do is they distribute Fit4D, usually under a white label, as part of their patient care, as a scalable way to touch their patients and get them through the barriers to initiation and get them persistent. And we've actually been proven by third-party companies that they've hired to deliver a 3-to-1 ROI. So that getting those patients through every barrier, get them starting and adherent to the medication, is great business for pharma, but it's also great for the patients.
How do you see this expanding globally, and do you see this type of solution working worldwide?
We're live right now in the US in English, Spanish, and Chinese. And so the Latin and South American and Mexican markets make a natural expansion because we already understand the culture, we understand the language, it's similar time zones as the US. And so we're being asked by both many different of our pharmaceutical and medical device companies to expand our work into those markets. And as we start to engage there, we'll start engaging with the health plans in those states and countries as well.
As you know, diabetes, it really is universal. It's impacting people all over the world.
Right.
It's really a big challenge today. So what are you most excited about today?
What I love is the pace of the acceleration in the healthcare industry is totally different from a few years ago. I see, to use the word, the startup health, batteries included, energy, a lot more in the health plan community than I did in years past, because people are starting to realize that what worked in the past can be improved. And, you know, there's a lot of technology that enables even companies like ours, the human touch, to scale and to engage people in a much richer and robust way, tools that we can use to measure results. And so, and that combined with the business drivers to demonstrate value and measure outcomes, those trends are combining to accelerate the pace of innovation. And I love that, because for companies like ours and the startup health community, we can engage in a much higher volume and be successful with our missions.
Too often today we think of innovation in terms of just technology. And what we're seeing, and I think you're a great example of, is a lot of the most exciting innovation is really the marriage between technology and the power of the human touch, or even great design thinking, or really innovative business model thinking. So I think you guys are a wonderful example of that innovation comes in many different forms, and that marriage that you guys bring is clearly making a big impact. What advice or thoughts do you have to other founders that maybe only think of innovation in terms of technology or data?
The more that they can roll out this solution in real world environments, that they're going to learn and they're going to see. You know, in our case, our early years, we were with clients like Bayer Diabetes and Weight Watchers, where we were innovating while delivering real solutions. And we learned what the optimal mix of, to your point, technology and human touch is, that worked. And it's even different now between the health plan market and, let's say, the pharmaceutical med device. Different levels of human touch, different goals. And that only could be achieved through real world engagement with real patients, and to learn and to listen and have definable metrics of success. So find those, you know, batteries included partners, and find a way to engage with real live patients, and just be open-minded to see what happens and what works.
Well, it's great to see you growing and rocking and rolling like a rocket ship, and all the amazing work that you're doing. So thank you for the Moonshot mission that you're on, and everything that you're doing. Thank you.
Thank you, Unity.